The literature shows absolutely no evidence that combining HIV/AIDS service programs with family planning or other reproductive health services program results in any synergism. That is, that you would achieve better results in the area of reproductive health or better results in the area of HIV/AIDS by combining them in some fashion. There also is no evidence that there's a cost effectiveness, that you can deliver the same unit of services less expensive in an integrated approach than you can in a vertical HIV/AIDS program or a vertical family planning program. The fact that there's not evidence doesn't mean that it doesn't exist. It just hasn't been documented. What has been documented is that many of the programs that are supposed to be integrated, when you actually go and look at them, they actually aren't. They're integrated on paper or in words. Some of the research has indicated that the complexities and the staff demands of having an integrated program have been underestimated, and that the true test of the wisdom of integrating hasn't really yet been made, because we actually don't have that much experience and that much documentation of bringing them together. Now, one of the issues is that that hasn't been fully recognized is that although the mode of transmission for the acquisition of HIV is obviously essentially the same as the acquisition of a pregnancy, sexual intercourse. But once you get past that, the similarities between the two things that you're trying to address quickly, if not evaporate, become less obvious. So that if you look at a client profile for a voluntary counseling and testing program, for example, and compare that with a family planning program, you would see the profile as being markedly different, with VCT populations being much younger, much greater percentage single, different types of sexual behavior than you have with the family planning. So that transporting a family planning program into a VCT program is almost guaranteed to fail. You need to do a family planning program that's designed and catered for the client profile of a VCT facility. And we actually haven't done that. We have a project in Ethiopia, and we looked in vain for a training module for counselors that would address the issues that you confront in the area of reproductive health for a profile at a client profile for a VCT facility, and it didn't exist. So we had to, along with some partners, create our own. But one area that is an absolute no-brainer, it's a no-brainer from a public health point of view, it's a no-brainer from an ethical point of view, is that HIV/AIDS positive women should automatically get information about family planning in every facility that they come across. It makes good sense from a public health point of view, and it is the most important and the easiest thing, not that it would be easy, but the easiest thing in the area that's to be done. Related to that, there's very little services for HIV positive women on the consequences of having a child, of offering support, of explaining some of the challenges that they're going to be facing, and to help them with those challenges. And it's very irritating to hear all this rhetoric and not actually to make the investment to help women with the fullest range of options that they're facing in a very difficult situation in terms of their reproductive desires and their HIV status.